So it's my pleasure to introduce Dr. Duke.
Thank you, bud. Is this thing on? Huh? No, I'm talking about, can you all hear me? I'm not talking about Jim, I'm talking about those people up there. We were supposed to punch a button, and I didn't know if I punched the right one or not. Well, I'm really touched that a fine young man like Stewart would run the risk of inviting me. I have a lot of respect for people who put themselves in the role of having to invite a speaker because they're really not sure what they're going to get. It's kind of like that Forrest Gump thing and trauma and a box of chocolates. You just not know what you're going to get. And he's very gracious in what he has to say. And I don't even recognize the guy he's talking about. But it is a treat for me to get to be over here at this medical school. I haven't been here in a long time. In days past, I was around quite a bit. But I've never been in this room. And I can tell you, it looks like, are these a bunch of lawyers you've got in here that got on these dark suits? I'm not afraid of lawyers. I like to ward them, but I've had a lot of fun. In fact, I got once upset one time. I had a heart attack, and I thought that was one of the high points of my career. He didn't have it right in front of me because I would hate to have to make some kind of a judgment about what to do, but I had him pretty worked up. Yeah. And I really do hate to waste my time, and I sure don't like to waste other people's time, and I do abhor boring talks. I just try everywhere in the world not to give that sort of thing, and I also have a whole lot of belief in the value of humor, and there are plenty of things to laugh about, and I think it helps you just live a little longer if you do it that way. I'm really a very fortunate person, man. I don't know why I could have so many opportunities to meet remarkable people and get involved in a lot of exciting, kind of interesting activities. And and I've been blessed to live a long time. And in that time, one thing that happens is you kind of get a little perspective about what you've been up to. And but when I look at myself, I just think of myself as just an old GP that may be a little overtrained. From the fellows that took care of me when I was a kid, but I do have immense respect and fond memories of them. And I'm also a frustrated school teacher. I'm sure that most of you have some 1, 2, 3 old teachers that you really reflect upon. And I'm telling you, Ms. Tinsley, Ms. Noel, and Ms. Tarpley were put on this earth to keep me straight. Ms. Tinsley would, when you're little, I imagine a person 30 years old looks old. I mean, in my mind, these women all look like they were ancient. And Ms. Tinsley would say, "Little boy." And I'm not lying to you. When I said that, I had a cold chill go down my back. Miss Noel taught Miss Tinsley. I couldn't get rid of her because I had her in the 4th grade. Didn't have her in the 5th. Skipped the 6th. I was in that age group of people when they went from 11 to 12 grades. And we skipped the 6th, and then I had her for the next 3 years, and she taught math and other things. And Miss Noel was our literature teacher. She kind of looked like the Wicked Witch of the West. I mean, But she did know, and Miss Tarpley was a blooming genius. If you ask her a grammatical question, she wouldn't answer you. She would tell you what page it was on. But at least you had to go to the literature. But anyway, I do, for some reason, like to mess with students and residents, and I don't know why, because, there's not that much difference between a medical student or a resident than a teenager. And there was 1 year in my life that I had 4 teenagers in the house to live with. And during that period of my life, I decided anybody that had more than 2 at any given time, there would be a law that you kill a certain percent of them. It'd be like a buck tag on a deer license. You can't figure out just which buck you want to kill, and you keep screwing around, and after a while the season's over and you haven't killed any of them, but they all need killing. But I've learned a lot from the students. They really have. One thing in particular that I like is there's one old boy, and he is kind of funny. He's 2 or 3 bubbles off plumb, but he's really a fun guy. And we were standing there gowned and gloved waiting for a nurse to come up and tie up the back of our gowns. He looked at me and he said, "Dr. Duke, I want to apologize to you right now for all the mistakes I'm getting ready to make." And I offer you the same thing, because I will make some of them. I'm kind of proud of the fact that I'm a human being full of mistakes. And nobody likes being the doc more than I do. It's a real privilege to be a physician. And it's even to a great extent more so as surgeons. Who else can invade somebody else's body? That's a real responsibility. And who else can ask a lady to take off her clothes? Think about it. And I like it. I've always enjoyed trauma. I like just taking care of patients, and whether I operate on them or not, but I've always kind of liked trauma, because it kind of is a kick in the rear end, I think it's probably not even an accurate statement to say I am an adrenaline addict, and I love putting myself in those positions and try to work myself out. But the problem is that getting older, you get tireder, and it takes longer to heal. And I mentioned something like that to one of my former residents one time. He said, "Yeah, I've had that same experience lately." And he's a lot younger than I am. He said, "I read the other day that you're getting old when you see a good-looking woman, your pacemaker goes off and your garage door goes up." Or you're getting old when you tell your friends you're having an affair and they want to know who's catering it. They had this old guy over in Nacogdoches turned 95, and the ladies of the town wanted to have a little party for him, and it was an afternoon, of course. They'd got to get him to bed early. And they had ice cream and tea, and there wasn't much news going on, so the Dallas Morning News sent a reporter down there to interview Mr. Johnson, and when things kind of calmed down, he got Mr. Johnson over in the corner, got out his pad, going to take a few notes, and he said, "Tell me though, Mr. Johnson, before we start, are you really 95? He said, "Yes, sir. Sure am, son." This old boy said, "Well, I hope I never live to be 95. And Mr. Johnson said, "That's because you ain't 94 yet." Now, one of the neat things about having the privilege of living a little while, you get to live through a certain amount of history, and you see things change and see events. And one of the tricks that happens to your brain is you compress it some way. It's all that memory, or a lot of it's still there, but it doesn't seem like it's as long as it is, but it's all there. And what becomes clearly evident is that things are always changing. This change is constant, just rigorously consistent. And it's inevitable. It's going to keep changing. And To try to illustrate that, I would like to, if you will allow me to indulge you with my personal experience, just with medicine alone. Now, I was born on a pretty cool November night in Ennis, which you may or may not know where it is, makes no difference. It was a little bitty hamlet in those days. I haven't been there in years, and I'm told it's gotten a lot bigger, just south of Dallas. Little bitty dinky hospital. And so was another little fella. Now, as the story goes, that little fella was brought to the lady that I call Mother. I don't know what they did with me. It didn't register in my memory bank at that time. I probably just wanted something to eat, still the same way. And then I somehow got switched around. Don't know what that means. There hadn't been any DNA checking. And then my mother named me David. And she told Dr. Clark that. Dr. Clark, so recorded it. My father took me to town and said, "Oh, you've got a junior." So he starts calling me James. When I go to get my driver's license at age 16, I find out that I am not James, I am David. I don't know who the hell I really am or for sure where I came from. And my first true medical memory was in Dr. Clark's office. And till this day, I can see that old instrument cabinet over there, clean, pristine, white porcelain. I guess that was porcelain on the steel and glass and the instruments laying in there. They were about to put me to sleep with chloroform, which, as you know, is a little bit hard on your liver. And they were going to and did take out my tonsils in the office. Why? Because I had them. That was the only indication. Not too long after that, Dr. Clark I'm sure he thought I had appendicitis, and he did an appendectomy. Now, do you guys, y'all know what a McBurney incision is? Well, that's what he did, but I don't remember it very well. He either had, Alzheimer's or, some terrible tremor or he was drunk. And it's not a very, it heals, but that's the way scars are. They'll always heal if you just don't get them infected. Or if you do get them infected, we do that too, but he gave it to Mother, gave the appendix to Mother and a jar of formalin. And she kept it until I guess my sister threw it out after Mother died, but it was perfectly normal, real long. It'd been a damn good earthworm, for bait, fishing bait. It looked just like one. And the next one thing that really got to be a problem is at that point in the cultural history, there was a ubiquitous fixation on the colon. And you learned, I don't know where all this came from, but you didn't mention feeling badly if you could help it because you were going to get an enema. I spent a good part of my young life with my little fanny up in the air, Now hold it, I'm sure my colon's a lot longer than yours is, They stretched that dude out a long way. And to give you another example, I almost get sick every time I think about this. But Dad took me down to Castello's drugstore one Sunday afternoon. We were still in Ennis, so I had to be under 7. And I forevermore loved root beer. You remember those A&W root beer things? And I was sitting at the counter, and for some reason, And I don't know, but he had to be involved, I guess. But anyway, the pharmacist put some castor oil in that root beer. And I'm telling you, I couldn't look a root beer in the eye for the next 40 years. But those of you that have never had it, just be thankful. Now, at age 7, I had pneumonia and measles. And as you know, in those days, there was no antibiotics. And most of you younger folks have never heard the term the crisis of pneumonia. But, and you probably never used digitalis leaf. We were using that when I was an intern. It's good stuff because you can't kill anybody with it. If you get too much dig in you, you'll start vomiting and see yellow, and you just can't, they can't hold it down. Well, Dr. Clark had decided he was going to get my heart ready for the crisis. The crisis meaning your immune system either kicked in 10 days or 2 weeks, or you died. And so he was going to get my heart ready for the crisis. I don't know why he thought that worked, but anyway, it was obvious to my mother that the digitalis was making me sick, and I was vomiting up my heels, you know, and so she was throwing it out to make it look good to him. And what she was doing is, my nutritional program there was she would cook steaks, you know, real good fatty steaks, and feed me the fat, those saturated fats. I don't know if that was some kind of certainly had a lot of calories in it. And, you know, very limited on available medicines. And, but they had rock candy and honey, and but the best part of it was the bourbon. I learned to love the taste of bourbon with that, you know, of that episode. Rock candy and bourbon, pretty good stuff. Yeah. We moved to Hillsborough when I was right around 7 or so, and that Dr. Besco and Dr. Smith were these two heroes of mine. You know, and they made house calls. And it's really funny, when they came to the house, there was just something magic about it that they came. They had an odor about them that was not offensive at all. And they would examine you, you know, and the stethoscopes were cold then like they are now. And but it was a real beneficial kind of experience. And I don't remember that they don't know what medicine they had much to give you, you know, but they bring the black bag in, you know. I heard a good story about an old GP. This guy got this call from this farmer, and he said, "Doc, my wife's about to have a baby. Can you get out here?" So the guy gets in his Model A Ford and starts out there. And as he gets close to the house, he sees the farmer on the porch waving a lantern. You know, just so they don't have any electricity, they just got coal oil lantern. Well, he pulls up in the yard, gets his bag out, goes in the house, and back in the back room, there she is. There's a coal oil lamp there, and she's obviously in labor. And he, you know, goes through the little preparation and stuff that had been made and starts examining her. In a few minutes, you could hear this baby cry, and he said, "Mr. Johnson, I'm happy to tell you you've got a lovely new little daughter." He said, "Bring that lantern over here." And sure enough, that's what it was. Well, this kind of pleased him, and he was apparently walking around, you know, kind of thinking, golly, you know. And he said, "Mr. Johnson, bring that lantern back over here." So he comes back over there, and in a minute, he hears another baby crying. And he said, "Well, look here, your little girl now has a new little brother." Well, that really did, you know, getting all this taken care of at once was a pretty good deal. And he's walking around thinking about it, and he said, "Mr. Johnson, bring that lantern back over there." He said, "I ain't going to do it. It's that light that's attracting them." Yeah, we had all kinds of diseases that you couldn't do anything about: strep throat, meningitis, polio, mastoiditis, these kind of things. Everybody, you can remember that. Scared you were going to have it. Yeah, we didn't know where it came from. But somehow we survived it. Some of the remedies were interesting. Y'all don't know what you missed by not having methylate. My father believed that methylate would cure anything, and so there is not a part of my body that can be reached with a swab soaked in methylate that has not been touched at least once. And, the more it hurts, the better it works, right? Yeah, it's alcohol-based. Now, ichthyol was just coal tar, really. It was really from the dregs of the cracking tower, but it will drain an abscess, but it stinks. It's just black tar stuff that comes in. I've seen it used recently, and the farmers still use it all the time. I don't know what this means about what I'm going to tell you right now, and I'm not drawing any conclusions, as I've heard things about it since, but I had a little bit of asthma when I was 8 or so. And the doctor gave me goat's milk. Well, I ain't got asthma anymore. But anyway, Dr. Stewart and I were talking a while ago. One of the strange things that I don't understand is people plant grass, water it, fertilize it, and then cuss it about having to cut it. If you're going to go to that trouble, I think it'd be wise just to get a goat, stake her out there, let her re-fertilize it. You can milk her, and then you'll have goat's milk and make cheese, whatever you want. Anyway, there was a big involvement, utilization of heavy metals. Now, we're still using silver, which works pretty good. Excuse me. But you can always, it's pretty common to be able to see an old boy that on x-ray looked like he had barium on his rear end. You knew he had been messing around. He had syphilis. That was bismuth that shot up his rear end. And they started using gold to try to treat tuberculosis, but they found that it didn't help the TB any, but it did. They noticed, and apparently still use it, that the people with rheumatoid arthritis improved in their arthritis anyway with these gold salts. And it's my understanding they still use them. And then there was arsenic. The most abused insect in the world is the spider. Everybody that gets just a plain old staph abscess think they've had a spider bite. And I don't know why they have this problem with spiders, but there's no use blaming them. They're just plain old staph. But I had a couple of abscesses, one on my left ankle, one right there, and Dr. Smith thought he was going to treat that spider bite, and he gave me IV arsenic, and I thought that was kind of interesting. You put it in here, I could taste it right quick, I don't know what it did to me, but you all may have some wonder too, I really like the old drugstores. It's a shame they're gone. You could buy virtually anything you wanted over the counter. Paregoric was just common. Nobody was trying to get high on it, but it ain't nothing but opium. And when I was a kid, I was a big kid. I was really frustrated chemist, and I was trying to make nitroglycerin, and you could get all the components you wanted in a drugstore just off the shelf to do that. Nitric acid, sulfuric acid, glycerin. I never could make it. I burned up a bunch of stuff with that sulfuric acid, but didn't get anything really done. We all had the measles, both kinds, chicken pox, whooping cough, and so forth. And the idea of a trauma system was many moons down the road. When I was in the last game in high school football, I was tackling an all-state back, and my best friend came up, polished him off, and hit me on top of the head and knocked me colder than a wedge. Now, they didn't run out there on the backboard. They didn't have any collars. You know, I don't know how I got to the sideline, but anyway, it probably drug me over there. I woke up and played the second half. I don't remember it, but anyway, I played, you know, and the first thing, we were playing in Waxahachie, and that's 40 miles from Hillsborough. And I remember the first thing I really remember that day or that afternoon was going through a real pretty area of a creek bottom and I never have been able to put my chin down on my hand since then, but so far nothing untoward has occurred. And and he mentioned I was in the Army during in 1951, 52, and we were living out in the snow, and I had to go to a base, and I went to the officers' club and decided to take a bath, which is always questionable, and I soaked a while in that big old tub, and I got out and went back out in the snow, and I had pneumonia in 2 weeks. For 2 days, and at age 22 is when I first got my first dose of penicillin. It turned out to be pretty good medicine. I got in medical school, and I just thought it was great. I mean, I was really finally what I really wanted to do. But we were somewhat limited, you know, in what we had. Our antibiotics in were penicillin, streptomycin, tetracycline, INH, sulfa, and TAS. That's it. It worked pretty well. I wish you all could have known the x-rays, that could have seen the x-rays, because we used to have those. When they developed them, they had their dark room, then they would put them in hypo, which I don't know what that meant, but it's the final solution, and they'd push it through, and you'd pick them up and read them wet, and then hypo, it does something to your airway. I don't know what it is, but every time I got sent back to the emergency room for a month, I always ended up with bronchitis. And, the only anesthetic that we had was ether and cyclopropane, both of which were explosive, and I never saw any problems with them. One of the things that you all have missed is all operating rooms, and I at Parkland anyway, had an ether induction room, because you had it took a while to anesthetize someone with ether if they had any adipose tissue whatsoever, because you got to go real slow and saturate the whole body uniformly. So while they were doing one case, they'd be trying to get a fat one to sleep, you know. And the operating room 2, ether induction, they were right across the hall from the elevator to the emergency room. We had an anesthesia resident there that he had a tendency to have tantrums. And I think the reason that I don't like that is because I think I tried it one time. My mother broke me. But anyway, you never know what's going. It's kind of like the damn volcano going off. It just all of a sudden. But this particular night, he had a guy on the table, drunk, and we were getting ready to operate on him. And George was messing around with his little Sears and Roebuck machinist cabinets, what they used for all their equipment in those days. And we also, our IV fluids were all in glass bottles, not plastic bags. And this guy, I don't know what he decided, but anyway, he sat up, disconnected it, and hit George right between the scapula with that bottle of ringers. Well, he didn't bobble. Believe it or not, he was just as calm as he could be. The guy gets up and goes over and punches the down button, and George walks out and just over by him and pops him in the rear end with some succinylcholine and leaves. It wasn't too long before George had control of the situation. They came back and intubated him, Yeah, but yeah, we didn't have ICUs in '67 when Governor Conley was shot. We didn't have one at Columbia when I was there. When I left to go to Afghanistan, we were working on designing the first ICU. They were it was obvious we needed it. I had the real privilege of working there with Kenny and the metabolic unit, and I was supposedly running it, but that's where I first encountered electronic monitoring and that sort of thing, which is really pretty neat. I like that idea of being able to accumulate information. We'd do all kinds of metabolic studies on a daily basis. Then I went off to Afghanistan for a couple of years with a group run a medical school in Jalalabad, and then came back to Houston. And it's hard probably for you younger folks to realize, but in 1972, I had never seen an EMT or a modular ambulance. They had started in Houston just 1 year before. And none of us that were interested in trauma knew anything about blunt trauma. There were plenty of gunshots and stabbings, but I guess all those people that were in car wrecks died, or I know I had a father-in-law who had a busted pelvis in '47 that he never could walk again not walk, normally. He could get around on crutches, but that's when we enrolled in Blunt Trauma 101 and really began to make some progress. It's been a real treat to work over there in that environment. And Mr. Dunn built a heliport over the entrance to the emergency room in '73, and nobody knew anything about helicopters. And I thought, well, it seemed like a good idea. We'll see if we can't make it work, And we messed around, finally got enough ideas and so forth. We got the board to give us enough money to lease a helicopter and some pilots and mechanics, and then I had to figure out what a flight nurse was, since there was no job description. And I have great memory of just muddling through, trying to figure out, kind of like pulling weeds out of the garden. Dr. Stewart mentioned that the business about regionalized trauma system, it seemed like the first mention of that in the literature was in 1970 from a fellow in Canada. And it really seemed like a good idea, and we got messing with it, and then Governor White, out of a clear blue sky, out in up Dripping Springs one day, I was sitting there talking to James Michener, and he said, "Red, would you help me start a regionalized trauma system in Texas?" I knew it fell off this bluff we were sitting on, but I didn't know that a politician knew those words. Well, we went to work on it, and then he had the audacity to get diselected, so that shot that down. But luckily it came along. It's kind of things really impressive. But I guess one of the things that's made the biggest impact on what we do is the imaging, the technology. It's been fun to watch I'll never forget the first CAT scan we had, and watching this radiologist try to figure out how to use it. And good, I didn't know anything about it. When I went to Houston, I'd never seen an interventional radiologist. We always did our own carotids and aortas, and change does not come easy, but it just keeps on. I have no idea where it's going. But one thing I am pretty sure about is there's always going to be sick and injured people who need help. And they really deserve the best we can give them. And they do want personal care that'll never change, I don't think. I could be wrong, but I doubt it. Just I know enough about human beings that we do need each other. And that's a noisy booger, isn't it? I think there's certain principles that are worth considering seriously about things that shouldn't change. And if you live by a code of, maybe some of you were Boy Scouts, that ain't bad. Honesty, personal integrity, that's the most important. That's the only thing you really got, your integrity. And it is so important to not get too carried away with how important you are, because you are important, but maybe not as important as you may think you are. But of course somebody will teach you that. Now, I can tell you that I didn't expect to be able to give you any wise bits of information, guidance, but I would like to make a few suggestions. And I even made it bigger last night, but I keep thinking of things. But just think about this as you go about your daily activities. Do something nice for at least one person every day. You'd be surprised how good that'll make you feel. And when things don't go well, when they do go well, give credit to others, and when they don't go well, don't start blaming somebody. Excuse me. Try to read at least an hour a day, something other than all the stuff we need to read. Now, I would strongly suggest that you not read fitness or glamour magazines, because it'll make you feel ugly or pitiful. Yeah. Now, if you make a mistake, admit it. Don't try to cover it up. Once you admit it, hell, there's no fun kicking a dead horse. And so, and we all make mistakes consistently. And also, it's really important when you do make a mistake that, I messed up, forgive yourself, and go on. Now, don't waste your time gossiping. That's a waste time. It'll hurt you as much or more than it does the one you're talking about. So there's nothing to be accomplished in that activity. If you haven't started stretching, it ain't too late. There's one definition of aging, and that's an implosion caused by the contraction of fascia. Don't brag about yourself. If you're worth anything, somebody's going to recognize it and talk about it. Now, one thing is particularly true of you, those of us, or any of us, but particularly if you're getting into the surgical thing, don't get excited. If you get excited, you're going to screw up and make a mistake. You get in a hurry, you're going to make a mistake. There are times when you got to get in gear, but know what you're doing and do it. Just proceed. One of the things I've noticed I've had to do, some of them in my life, is calm people down, and you would probably be offended by my technique. Get to know your parents. You're not going to have them forever. You might find they're more interesting than you thought. Always give a friend a helping hand, especially when they're hurting. Now read directions even if you don't plan to follow them. And if you're trying to get somewhere, ask for directions. It shows a modicum of humility. It might save you some time, and get you where you're going. Always remember the kind words of thank you, please, and may I. Now, this is one of my, as old as I am, I can have all the damn pet peeves I want. And this is one of them, and I'll have a resident say, I'll take a hemostat, and I say, the hell you will. You ask for it nicely. If your mother didn't teach you, by golly, I'm going to, And of course, the techs or nurses love that, and then in a minute they'll do it again and say, whoop, nope. Ask nicely. It's like training a bird dog. It's no different whatsoever. Residents and bird dogs are very similar. And another really important trick to learn and to stay with is if you borrow something, you take it back. And after you've done that for a while, you can borrow anything in the hospital because they know you're going to bring it back. Sometimes I get something that I want, and a resident will offer, or a student will offer to take it back. I said, nope, I take them back. I borrowed it, I'm taking it back. And you'd be surprised how helpful that is when you really get to know the place and the people, and they know you to be a reliable person. Now, it's really important to learn to pay attention to the efforts of all the people that you encounter, the housekeeping people, the dietary people. Recognize that and tell it, I'm not kidding you. Those floors over at Herman at midnight, you can shave in them practically. And I tell them how much I appreciate it. And I recognize that they're working. And that just makes for a better environment. Be kind to your knees and your back. You'll miss them when they're gone. You do not know how valid that is. Now, I presume when you write something, you are endeavoring to communicate something. Well, if you're going to write it, then damn it, write it where it can be interpreted and not some scratch. There is no excuse for notes you can't read. These are legal documents. And believe me, I would get after you like, a chicken on a June bug if I were on the other side and you do that. And I go out of my way to write clearly. And I also go out of my way to chew the rear ends of those who do not. I'm going to do a grand round someday over there where I'm going to embarrass a lot of people if I just take the time to do it. And start just showing notes that they've written. And that's one of those to let it fall where it will. I didn't start it, but we'll damn sure stop it. But smile at people. You'd be surprised how many frowns you can melt with a smile. Speak to them. And they appreciate they're being acknowledged. It's another form. Now, one of the most valuable things I can tell you is be nice to nurses. Nurses are programmed in their being to take care of things. They can't help themselves. They do want to take care. If you choose to be an arrogant little booger and, like some people are, they'll take care of you, I'll assure you. And that's kind of like some yahoo that comes in the emergency room and starts acting up. And I always tell but I got all the needles. I can deal with you. And it makes me no difference how you want to do it. But, always pay attention to those folks. Man, they are worth their weight in platinum, man. Try to remember to touch old people more frequently. They really do need, but don't be careful how you do it. Don't. don't bust a bunch of ribs with an enthusiastic hug, but old people really do need, a pat, a touch, or whatever. And one thing that I preach all the time, besides think, damn it, think, is to treat every patient just like you'd like to be treated. If you'll treat folks that way, they will be they get pretty good care. But all this slipshod stuff that I see go on, that's not acceptable. One of my other pet peeves is people taking those dirty gloves off of the wall that are there to protect the physician, and handling open wounds. Now, would you want anybody to do that to one of your wounds? Hell no. Another thing, if you don't learn anything from me but this, dentists are so much smarter than we are about local anesthetic. What they block you, and then what do? They go somewhere else and fix a guy's tooth or a filling or do something. And when they finally come back, you got the slack jaw like that, right? We don't have anything to do, so we squirt it and cut. Always, when I'm putting in a chest tube in an alert person, I always, if I'm there, I block 5 or 6 ribs, intercostal block, wait 20 minutes, and you can put that dude in and they won't know you did it. But you got to let the local take effect. Excuse me. It's no sin in being able or have to shed a tear with somebody for your own broken heart or somebody else's. And always say your prayers. And then lastly, laugh. Find something to laugh at. I'm sitting here looking at all kinds of things to laugh at. But if you can't find anything else to laugh at, go look in the mirror, friend. She's right there with you all the time. I thank you very much. If you got any questions, I'll be glad to talk. I may not be able to get to you. Anybody want to pursue any? I'm not an encyclopedia, but I'll be glad to talk. Yes, ma'am. Let me get over here. I'm deaf at the damn post. Those tank guns ruined me. That's the reason I talk so loud. I can't think anybody can hear it better than I can.
Well, you can start. You can tell us how you got the name Red.
Well, they're all little red-headed boys. You know why people are red-headed? Well, it means we put more iron in our hair than other people. That's no lie. And it's a mutation that occurred in Northern Europe, and it's cloudy. And redheads make more vitamin D from the same quantum of ultraviolet radiation than other people. We also make more skin cancers, too. But the reason that all little redheaded boys are called red, and mine just stuck. And as you get older, you can't put that iron there. And you've probably seen women cheat. If they're redhead, they'll do something to color their hair, but men usually don't. And hello, Skeeter, how are you? I'm glad to see you today. And it'll kind of get orange and then pink, but it never gets quite white. And my father had a white beard, but you can see my mustache is not quite, it ain't ever going to get quite white. Anything else you want to talk about? You probably want to get the hell out of here, don't you? Well, thank you for having me.
Thank you, Dr. Duke. So, Dr. Duke, just a couple of things you don't know. Today's Dr. Duke's birthday.
made it again.